Biomechanical pain made simple, Part 1. As you are probably aware, there is more than one type of musculoskeletal pain. Learning which you have is a vital step towards healing. Drawing out these distinctions can even be a make or break issue. If you have a pain that only requires a quick fix, understanding it yourself is not so important. Getting a filling is a good example of this. It only requires that you open your mouth wide and be brave for half an hour or so. Resolving a stubborn pain is like wanting to go from chronically unfit to consistently fit. Professional help and support is needed along the way, but all fitness journeys also require learning. If you want resolution of your stubborn pain, this principle of learning must be obeyed. Permanently resolving your pain will take more Irish luck than you most likely possess, if you aren't sure what type it is. Luckily, most people find that various pain types can be easily understood when they are clearly explained. Some pains do, however, take a little more explanation than others, because they are conceptually less familiar to us. Biomechanical pain. If you have stubborn pain in a muscle, joint, nerve or your soft tissues, it's highly likely to be biomechanical pain. Biomechanical pain is caused by factors relating to movement and posture. If you understand the repetitive strain concept, you already know exactly what biomechanical pain is. Biomechanical pain is caused by a repetition of movements or positions that your body doesn't like. It is pain that develops over time. Your body can do a huge amount of work. Partly because it's tough, and partly through endless repair and regeneration. But your body also has limits that must be respected. Biomechanical pain is your body letting you know these limits are being exceeded. Biomechanical pain can be caused by too much movement, overuse, by not enough movement, immobility, or by faulty movement, inefficiency. Specific causes of biomechanical pain include poor postural habits, repetitive work tasks, being a couch potato, old unrehabilitated injuries, flat feet, high arches, being heavy-footed, overtraining, undertraining, bad training habits, occupational overuse, wrong footwear, St. or having large breasts, environment. There are two kinds of biomechanical pain. Understanding their similarities and differences is super important. Simple biomechanical pain. You notice your lower back starts to feel stiff in the mornings, just until the shower warms you up. At first, you don't think much of it, but you become slightly more concerned when it doesn't go away. You continue in this state of mild concern for about 6 months, but you don't get around to having it looked at. Then one day, you get a hot jab of scary pain while you're moving boxes in your garage. You feel it in the exact spot that's been stiff in the mornings. Then gradually over the course of the day, it locks up. You are extremely stiff, to the point where you feel like your walk has become a waddle. You are woken the following morning by a knife of pain, triggered by you shifting your position in bed. You don't need to open your eyes to know you are in deep trouble, you can feel it. It takes you 15 agonizing minutes to get out of bed. Once you are finally up, there is less pain, but you can't stand straight, you are walking like a 95-year-old, and you can't even take yourself to the toilet. You have never experienced pain like it. You go to the chiropractor who takes an X-ray, which is completely clear, and she performs some tests. It turns out your sacroiliac joint has locked. She explains that it has been building over some time, which makes sense to you because of how you have been feeling. She suspects it has been caused by a combination of flat feet and lack of exercise. You knew you had flat feet and you haven't been to the gym in 2 years, so it seems entirely possible. She suggests a course of treatment, and you are back to normal within 3 weeks. After 8 weeks she has you back to feeling good in the mornings too. She gives you some insoles for your shoes and suggests a checkup in 6 months. If your tissues are exposed to repetitive strain, unhealthy reactions may eventually start to occur. These physical reactions can be viewed from 2 perspectives, depending on how closely you look at them. A hands-on look at simple biomechanical pain reveals changes like muscle weakness, muscle imbalances, muscle spasms, joint stiffness, postural alterations and flat feet. A microscope look at simple biomechanical pain reveals changes like inflammation, tight muscle fibrils, microscopic scar tissue, adhesions, microscopic damage to collagen cells and fluid congestion. The wisest way to view all of these physical reactions is as warning signs of potential trouble further down the track. Which is of course how we should also view stubborn pain patterns in the body, as warnings. It is incredibly hard to know what the real numbers are with biomechanical pain. What I can tell you, is that in many healthcare settings you might see 100 cases of simple biomechanical pain, before you see any of the other types of pain. With the possible exception of complex biomechanical pain, which we will explore in the next video. So make sure you watch the video titled, Complex Biomechanical Pain on this blog or YouTube channel. In the meantime, give us a call on 04385 6446 to have us look at a treatment plan to help you get rid of your pain and discomfort.